Assalamualaikum warahmatullahi ta'ala barakatuhu. Greetings of peace everyone. So for this video, we will discuss the last unit for our fundamentals of nursing, which talks about basic nursing procedures. So this includes actually discussions on medications and nurses notes. So this is the first part of the discussion, which is focused on medication. Okay. So medication is a substance administered for the diagnosis, cure, treatment, or relief of a symptom or for prevention of diseases. In the healthcare context, the words medication and drug are generally used interchangeably. The term drug also has the connotation of an illicitly obtained substance such as heroin, cocaine, or amphetamines. That's why when we talk about giving drugs to your patient, we use the term medication because usually the word drugs is not that used properly or in a positive way. So drug is a chemical substance typically known of structure which when administered to a living organism produces a biologic effect. So example, we have antibiotics, we have antihypertensive drugs, we have your antacids or antacids. We have also there are lots of different of medications that we give to our patient for the management of their diseases or to improve their well-being. So medication is a written direction for the preparation and administration of a drug is called a prescription. Okay, so example here is the picture we have here, which includes the name, the age, the address, the sex, and then the date. Especially, it's very important to know the date of the medication, especially if it's antibiotic, because antibiotic should be given depending on the specific date or treatment regimen, because antibiotics are hepatotoxic and toxic to the kidneys, so we have to follow the strict therapeutic regimen. So one drug can have as many as four kinds of names. First, they have generic names, the trade name or their brand name, their official name, and then the chemical name. So the generic name is assigned by the United States Adopted Names or USAN council and is used throughout the drug's lifetime. And then the drug's trade name, or what we call also known as your brand name, is the name given by the drug manufacturer and identifies it as a property of that company. The official name is the name under which a drug is listed in one of the official publications, such as the United States Pharmacopoeia or any what do you call this official publications that is available in the market. And then we have also the chemical name, which is the name by which a chemist knows it, and this describes the constituents of the drugs precisely. So it's very important that among those names that we need to really learn and understand, is very important that you know the generic name, because there are lots of difference of brand names, so they only have the one generic name. So when learning names of medications, it's very important to take note the generic name among all the names that have been mentioned. So what are the processes of administering medication? So first is to identify the client. It's very, very important that you have properly identified your client when giving medication. So how do you identify the client? So through asking the patient to state their full name and then date of birth, and then by looking at their ID band or wristband. Okay, so errors can and do occur, usually because one client gets a drug intended for another. One of the Joint Commission National Patient Safety goals is to improve the accuracy of client identification. This goal requires a nurse to use at least two client identifiers whenever giving medications or administering medications. Neither identifier can be the client's room number or the physical location, so it's not included. Okay, so because patient can be transferred from different room number or physical location, so you have to avoid that. The acceptable identifiers may be the person's name, assigned identification number, telephone number, photograph, or other specific other person specific identifier. In hospital, most clients wear some sort of identification such as wristband with name and hospital identification number. So after identifying the patient's the client, you will now inform the client. So always remember that when we give nursing procedures to our client, it's very important that you explain the procedure to the patient. Why? So that the patient is informed and he or she can give consent to that specific procedure. So if the client is unfamiliar with the medication, the nurse should explain the intended action as well as any side effects or any adverse effects that may occur or be experienced by the patient. So after identifying the client, after explaining the procedure or after explaining it to the patient, then you will now allow or you will now be able to administer the drug. So read the MAR carefully, okay, the medication ticket, okay, and then perform 3 checks with the labeled medication. So example, what are the 3 checks? So first is read the MAR and remove the medications from the client's drawer. Verify the client's name and room number match the MAR or medication receipt, okay, or ticket. Then compare the label. Okay, and then afterwards, if the dosage does not match the MAR, then determine if you need to do a math calculation. Check the expiration date of the medication. So the second check, while preparing the medications, look at the medication label and check against the MAR. And then the third check, recheck the label on the container against the MAR before returning to its storage or before giving the medication to the client. And then you will now be allowed to administer the medication in prescribed dosage by the route ordered and at the correct time. There has recently been a change in what is considered the correct time. Historically, a 30-minute rule or administer medications within 30 minutes before or after the schedule was used. Okay, so after giving the medication and administering the medication, then you have to provide adjunctive interventions as indicated. The clients may need help when receiving medications. They may require physical assistance, for example, in assuming positions for intramuscular injections, or they may need guidance about measures for or to enhance drug effectiveness and prevent complications such as drinking fluids. Some clients may express fear about the medications, and the nurse can relieve fears by listening carefully to clients' concerns and giving correct information. So after that, you have to record the drug administered. Actually, when doing your documentation or recording, it's very important that all of the procedures that you have done to your patient, all of the medications that you have given to your patient must be recorded, because we have this kind of policy or guidelines that if it's not written, then it's not done. Okay, so if it's done, it should be written. So the facts recorded in the chart in ink or by computer printout are a name of the drug, the dosage, the method of administration, the specific relevant data such as the pulse rate taken in most settings prior to the administration of digitalis, especially you have to take note of those vital signs that is important when giving medication. Example, antihypertensive drugs. From the word antihypertensive drugs, these are medications that lowers the blood pressure. Now, you have to check first the blood pressure of the patient, because if the patient has low blood pressure, then you are not allowed to give the medication further, because it will cause the blood pressure to lower down. So you have to check. Another example is your antipyretics or medications that used for lowering fever. So if the patient is hypothermic, meaning below normal body temperature, then you have to recheck when giving the medication. So, or any other pertinent information. So the record should also include the exact time of administration and the signature of the nurse providing the medication. Many medication records are designed so that the nurse signs once on the page and initial each medication administered. Often, medications that are given regularly are recorded on a special flow record. So after that, evaluate the client's response to the drug. The kinds of behavior that reflect the action or lack of action of a drug and its untoward effects or the adverse or side effects are as variable as the purposes of the drugs themselves. So we have here the different 10 rights of medication administration. So this is the typical or the most or general 10 rights that are used in the hospital setting. However, there are specific hospitals, just like here in Marawi City, we have a public hospital that they have at least 20 rights of medication. So, including these 10 rights, and they have included another 10 rights. It's depending on the hospital actually. They can either add another policy, especially if there are certain medications that are only applicable or only available at their hospital. So we have here first is right medication. The medication given given was the medication ordered. So it's very, very important to check the physician's order because giving medication is a dependent nursing intervention. So you have to check the doctor's order. After that, the right dose. The dose ordered is appropriate for the client. Give special attention if the calculation indicates multiple pills, tablets, or large quantity of liquid medication. Especially if the medication is in powdered and you have to dilute it. So you have to really calculate the dosage properly. So how many mLs you need to dilute the medications and then how many mLs will you withdraw from the vial. So we have double check calculations that appear questionable, know the usual dosage range of the medication, and question a dose outside of the usual dosage range, especially if it's beyond the or above the average range for a day. So we have in future, I think, or you have already took the pharmacology. So in studying pharmacology, you will learn that there are specific medications that the medications has specific ideal dosage for per day. Okay, so next is right route. Give the medication by the ordered route. So we have different types of routes. We have oral, we have anal, which is your suppositories. We have also your parenteral, such as your injections. No? So we have intramuscular, intravenous. We have also your subcutaneous, and then we have your intradermal medications. So we have also patches, intradermal medications. Okay. And then we have also the right client. So medication is given to the intended client. Again, we have two methods of identification that is acceptable. First is asking the patient to state their name and then date of birth. And then the second identifier is to check their wristband or ID band. And then we have here right client education. It's very important that you have to explain any information about the medication to the client. Next, we have right documentation. Document medication administration after giving it, or it should not be not before. Because what if the patient had certain reactions or untoward certain problems before giving the medication, and then you have already placed it or recorded it that you have given it. However, due to some certain problems, you have not given the medication. So in documentation, it's very important not to note any errors in the chart. So we have to right to refuse. So this is the right of the client to refuse for any certain medications that they feel that they don't need it. So you have to ask the patient to write, to sign a refusal form that he or she refused the medication. So if anything happens to him, it's not the hospital's or problem, or the blame should not be placed on the hospital and any healthcare providers. So right to refuse, adult clients have the right to refuse any medication. The nurse's role is to ensure that the client is fully informed of the potential consequences of refusal and to communicate the client's refusal to the healthcare provider. And then right assessments. The medication requires specific assessments prior to administration, such as checking the apical pulse, checking the blood pressure, and lab results. Medication orders may include specific parameters for administration, such as do not give if pulse is less than 60 or systolic blood pressure is less than 100. So there are doctors that who really write specific parameters that we need to measure before giving medication. So we have to take note of that. And then we have also right evaluation. Conduct appropriate follow-up. So, was the desired effect achieved or not? Or did the patient or did the client experience any side effects or adverse reactions? So, we have here different types of drug preparations. Again, we have here your types. We have aerosol, spray, foam, aqueous solution, suspension, your caplet, capsule, cream, auxiliary, extract, gel or jelly, liniment, lotion, lozenges. You have ointment, paste, peel, powder, suppository, syrup, tablet, tincture, or transdermal patch. So we have here the specific descriptions that you can you got this identify. Okay, so you just check the different types of drug preparations. So we have also the different routes of administrations. We have your oral, meaning in the mouth or by per orem, or the PO meds or per orem medications. And then we have also sublingual. It is at the back of your tongue. Okay, we have buccal area, or same as sublingual. However, it is more on the cheeks of the mouth. And then we have the rectal, the vaginal, the topical, the transdermal, subcutaneous, intramuscular, intradermal, intravenous, and through inhalations. So we have here the advantages and disadvantages of these routes of medications. Okay, so you can check this table out. And then we have the practice guidelines when administering medications. So again, nurses who administer medications are responsible for their own actions. No? If you prepare the medication, you have to give the medication. And if you given the medication to your patient, you have to assess the patient. And then you have to record anything that you have done to your patient. Be knowledgeable about the medications you administer. That's why you have to really learn about those types of routine medications that are used in the hospitals, especially when we are the client advocate. There are some doctors who give dosage or medication orders that not really good for the patient. So as the client advocate, you have to question those orders. So you need to be knowledgeable about that, because if you don't know that this is not appropriate for the patient, then you cannot advocate for your patient. And then federal laws govern the use of narcotics and barbiturates. So you have to be careful of that, because you have to check if the patient will be dependent on specific medication, because it may lead to addiction. Then keep these medications in a locked place. Do not or use only medications that are clearly labeled container. So if there is no label, then you have to discard it. Do not use liquid medications that are cloudy or have changed color. Calculate drug doses accurately. Administer only medications personally prepared. Before administering medications, identify the client correctly. Do not leave medications at the bedside, with certain exemptions, especially for nitroglycerin or cough syrup. So again, it is based on agency policies. What are those medications that are allowed to be placed at the bedside of the patient? If a client vomits after taking an oral medication, report this to the charge nurse or the primary care provider, or both. Take special precautions when administering medications. For example, have another nurse check the dosage of anticoagulants, insulins, and certain IV preparations, especially in insulin, because we use units instead of milligrams or grams. So you have to check on that. And then we have specific syringe that we used when withdrawing insulin. And then we have also most hospital policies require new orders from the primary healthcare provider for a client's post-surgery case. And then when a medication is omitted for any reason, record the fact together with the reason. When a medication error is made, report it immediately to the nurse in charge, the primary care provider, or both. And last but not the least, always check a medication's expiration date. So now let's talk about the types of medication orders. So we have 4 types of medication orders that are commonly used in the hospitals. First is your stat order. This indicates that the medication is to be given immediately and only once. So we have also single order or one-time order. These are medications to be given once at a specified time. So example, during hours of sleep, one time only. Okay, so that's a single order. We have also standing order. This may or may not have a termination date. A standing order may be carried out indefinitely until an order is written to cancel it, or it may be carried out for a specified number of days. So in some agencies, standing orders are automatically cancelled after a specified numbers of days or must be reordered. So example, we have ketorolac. So ketorolac is usually given for 6 doses or 6 days. Okay, or 6 doses. So you have to take note how many doses have been received by your patient so that you will know that if he or she already achieved the 6 doses. And then we have also the PRN order or as needed order. This permits the nurse to give medication when, in the nurse's judgment, the client requires it. Example, giving medication such as antipyretics. So we give it only if the patient experience hyperthermia or fever. The nurse must use good judgment about when the medication is needed and when it can be safely administered. So that is why we have to have a good and correct knowledge about certain medications, because PRM or a as needed order must be assessed properly by the nurse. So what are the essential parts of medication order? So first, the full name of the client. Then next, the date and time the order is written. Name of the drug to be administered, the dosage of the drug, the frequency. So if it's BID, when we say BID is twice a day, we have TID, thrice a day, or or we have also medications such as every 8 hours, every 6 hours, every 12 hours. We have also once a day. Okay, so depending on the frequency. And then route of administration, and then the signature of the person writing the order. So now let's talk about preparing injectable medication. So injectable medications can be prepared by withdrawing the medication from an ampule. So this is an example of ampule, and we have your vial. Okay, wherein a sterile syringe is used to withdraw the medication using pre-filled syringes or by using needleless injection system. So vials and ampules that have different colors, have different images depending on the manufacturer and depending also actually on the place of origin of that specific medication. So we have ampule. An ampule is a glass container usually designed to hold a single dose of a drug. So usually ampules must be used at least once. Okay, so it is made of clear glass and has a distinctive shape with a constricted neck. This may vary from 1 to 10 ml or more. Most ampule necks have colored marks around them indicating where they are pre-scored for easy opening. To access the medication in an ampule, the ampule must be broken at its constricted neck. Traditionally, files have been used to score the ampule. Today, plastic ampule openers are available that prevents injury from the broken glass. The device consists of a plastic cup that fits over the top of an ampule. The head of the ampule, when broken, remains inside the cup and is placed into a sharp container. If an ampule opener is not available, the nurse can clean the ampule neck with an alcohol swab and using dry sterile gauze, snap off the top of the ampule. Once the ampule is broken, the fluid is aspirated into a syringe using filter needle or filter straw so that the any broken glasses will not be included in the medication. So we have here a video on how to okay. So I think I'm very sorry for that, but the video was removed. But you can watch actually any videos available in the YouTube on how to break properly the ampule. So preparation from medications from ampules, withdraw the medication. So we have here first is to break the neck. Okay, again from the constricted neck, and then you have to withdraw. Make sure to place the tip of the needle, the needle bevel needle, bevel of the needle at the tip of the ampule, not the do not put the needle in the entire ampule. So you have here, or you can use this technique. It's either of the two. If you are sure that the fluid will not come out from the ampule, then you can use that one. So again, place the ampule in a flat surface, attach the filter needle or straw syringe. So remove the cap from the filter needle and insert the needle into the center of the ampule. Do not touch the rim of the ampule with the needle tip or shaft. And then with the single dose ampule, hold the ampule slightly on its side. It's necessary to obtain more than that the order amount of the medication. So next for the vial. Vial is a small glass bottle with a sealed rubber cup. Vials come in different sizes, from single-use vials to multiple-dose vials. They usually have metal or plastic cup that covers the rubber seal and must be removed to access the medication. To access the medication in a vial, the vial must be pierced with a needle. In addition, air must be injected into the vial before the medication can be withdrawn. Because failure to inject air before withdrawing the medication leaves a vacuum within the vial that makes withdrawal difficult. A single-use vial contains one dose of medication and should only be used once. In contrast, a multi-dose vial is a bottle of liquid medication that contains more than one dose, such as insulin or vaccination vial. So you have to take note of that one. So my video was not again entirely removed, and how to do reconstitution of your powdered medication. So again, how to reconstitute first is to especially again, usually vials can be a liquid in liquid form or powdered medication. Now, a vial with powdered medication, you have to check the hospital's policy on the dilution. So how many ml of PNSS or sterile water should be used to dilute the powdered medication? So after knowing that, then you will withdraw the PNSS or sterile water and then put it on the vial or inject it on the vial. Wait for the powder to be dissolved. Okay, after that, make sure that the powder is fully dissolved with your sterile water. So we have here again, it's very important to inject air. So how many ml of air do we inject? So depending on the dosage, okay, or ml that you need to withdraw from the medication or vial. Example, you need to withdraw 1 ml only of medications, then you can now inject 1 ml of air. And then after injecting, okay, withdrawing the medication from a vial that is held with the base down. Okay, so just like this one. Okay, so withdrawing a medication from an inverted vial. So after inserting, make sure to push properly, okay, and to hold the plunger of the syringe properly, because after injecting the air will now pop up. Okay, so you have to be careful with that. So now let's talk about methods of calculating dosages. Now there are four common formulas that are used to calculate drug dosages, and any of the formulas can be used. Nursing students are encouraged to review all four and to choose the method that works best for them. It is important to use one method consistently and to avoid confusion in calculation and thus promote client safety. When calculating drug dosages, there are times when the nurse may need to round numbers. So first, we have the basic formula, which is commonly used and easy to remember. We have the formula is equals to desired dose, or the dose ordered by the physician, and then times or multiplied by the vehicle or the form in which the drug, or volume. V can be volume or vehicle, okay, over H, or divided by H, or dose on hand. So we have again doctor's order times or multiplied by the stock on multiplied by volume divided by stock on hand. Okay, so example, we have here order erythromycin of 500 ml. So the stock on hand is 250 and 5 ml. So we use the 500 ml because this is the desired milligram. And then you divide it to 250 milligram because that is the stock on hand. So the stock on hand has in 250 milligram, in 5 ml there is 250 milligram. So you have to use the 5 ml as the volume or vehicle. So 25 divided by 250 is equals to 10 ml. So this is your desired volume. This is the volume that you need to withdraw from the vial of the medication, or from the what you call this, from the bottle. Okay, so for the ampule, example, administer 2 milligram of Dancentron ampule. Okay, so we have here the desired dose is 2 milligram, and then the stock on hand is 4 milligram. So times 2 ml, so 0.2 divided by 4 is 0.5, times 2 it is 1 ml. So another example, we have 10 milligrams of metoclopramide. Okay, so the desired dose is 10 milligram, and the stock on hand, as you can see, we have here 5 milligram per ml. So in 2 ml, there is 10 milligram. So 10 divided by 10 is 1, times 2, meaning 2 ml ang desired dose. Okay. So, for the vial, we have here 1 gram of ampicillin. Okay, so example, the order is 20. I think this is wrong. Okay. So, another is we have here 150, administer 150. It should be 150. And then you have the stock on hand of 250. So the desired dose is 150 divided by 250 milligram times 3 ml. So we have here 1.8 ml. So we use, instead of the term volume, because in ampule it is a liquid form. Okay, here we use diluent, especially for powdered medication in a vial. So you have to check for the hospital's policy what are the ml of sterile water or PNSS that is needed to dilute the medication. Okay, so we have another example, 2.25 25 milligram of your Peptaz or peptidazoline, tazobactam. So the available dose is 4.5. So we have your example, the diluent is 10 ml. So 2.25 divided by 4.5 is equals to 0.5 times 10 ml. It is 5 ml. So adding medications to intravenous fluid containers. So this is what we call your large volume infusions, or IV infusion. So meaning the IV or the dextrose or intravenous is infused with certain medication. So mixing a medication into a large volume IV container is the safest and easiest way to administer drug intravenously. The drugs are diluted in volumes of 250, 500, or 1000 ml of compatible fluids. It may be necessary to consult a pharmacist to confirm compatibility. Fluids such as IV normal saline or your PNSS, or your PNSS is plain normal saline solution. Or lactated ringers are frequently used. Commonly added drugs are potassium chloride and any vitamins. Medications such as antibiotics, it can be diluted or infused with IV. However, it should be not really infused on the IV, but it should be placed in, or sometimes it depends on the hospital policy, but here in Marawi City, we do use Solicet to infuse the medication with IV, PNSS, or lactated ringer. Okay, so administering IV medications using IV push. So first you have to check for the IV lock or the injection port. So check if it needs needle or needleless, because there are now ports that you have to remove the needles. You have to inject the barrel, and then you have to push and then lock it. Okay, so always clean the injection port with antiseptic swab, and then insert the needle of the syringe containing normal solution through the injection port of an IV lock, and then aspirate for any blood. Okay, and then flush the lock by injecting 1 ml of saline slowly, and observe the area above the catheter for puffiness or swelling. So this indicates infiltration into the tissue, which would require the removal of the IV catheter. So again, this is again, I have here the steps. Okay, so using a watch to time the rate of the medication injection. Okay, and then a blunt plastic cannula replaces a sharp steel needle. Remove the needle and syringe. Activate the needle safety. Okay, and then stopping the IV flow by pinching, okay, the tubing above the injection port, and then you can now inject the medication by IV push to an existing IV using a needleless or with needle system. Okay, so now let's talk about intravenous fluids, or your IV fluids, or in Philippine setting, this is commonly used by or commonly known by patients as dextrose. Okay, however, in the medical field, we don't use really the term dextrose, because there are IV fluids that are specific that has dextrose or sugar 5%. So what are IV fluids? So IV fluids are liquids that are injected in the person's veins or through an IV or intravenous tube. They either prevent or treat dehydration and electrolyte imbalances. Now, why do we use, or why in the hospital settings, IV fluids are used? Water is essential to every cell in our bodies. In fact, our bodies are made up of 60% of water. Now, when you don't have enough water in your body, that's called dehydration. So, a person needs IV fluids when they become dangerously dehydrated. So, ang main purpose or reason why do we need to use IV fluids is to hydrate the patient. Now, what if the patient doesn't need hydration? How can we give medications through intravenous? So we can give through medications through intravenous by giving it through heparin lock or HepLock. So we can use that one if the patient doesn't need hydration, especially with the patient with edema or too much fluid in the body or experiences swelling. So you can use heparin lock to give medications through IV injections. Okay, so if there is, again, another reason is if there is a serious dehydration that may occur when you are sick or vomiting. So if you also exercise too much or spend too much in the heat without drinking enough, and have a serious injury or burns, and have surgery, especially when you're asleep for too long time and are unable to drink or eat, then you need IV fluids. So what happens during rehydration with IV fluids? If you need IV fluids, a healthcare provider will decide the type of IV fluid you need, because we have 3 types of mind you, we have three types of IV fluids. We have hypertonic IV fluids, we have your hypotonic, and we have your isotonic IV fluids. And these have different effects on our body. So determine the amount of fluid you need and how quickly. So this is based on the many factors, including your weight, your age, and the medical condition. So patient with heart diseases should not be given in fast regulation of IV, and it should not be given in or they should not receive large volume of intravenous fluid because they are at risk of having or may experience cardiac overload. Okay, so disinfect or clean the skin where the IV will go, usually on the inside of the elbow or top of the hand. Tie an elastic band or tourniquet around your arm to make blood fill the veins. Examine the veins to find exact insertion site and slide a sterile needle into the vein, which may pinch. The needle will have a small plastic tube at the other end of your body. So, remove the tourniquet. Place a small plastic attachment into the tube. Test the tube to make sure a little bit of fluid can go in. And now you can tape the IV needle to your arm so that it stays in place. Attach the small tube into a longer tube and then attach it into a bag of fluids. Hang the bag from a hook on a tall stand and then turn on the machine that will pump the fluid into the IV line and check your IV line regularly if it follows the correct prescribed rate. So what are the advantages and risks of this procedure? IV rehydration is common, simple, and safe procedure that can make you feel better quickly and safe and help save your life if you are seriously ill. But rare complications can occur, including air embolism. So from the word air embolism, this occurs when an IV pushes too much air into the vein. It's very rare, however, can have serious consequences, including possible death. Okay, so you have to really check the IV of the patient. If there are any bubbles or any air in the tubes or cannulas. Collapsed vein. Sometimes the vein collapses when the needle is inserted or when an IV is in place for a long period of time. Actually, intravenous fluid should be changed after 48 hours or after 2 days. So after that, this is actually to prevent any complications in the IV such as infections. However, especially here in Philippine setting, the IV site is not usually, or the IV is not usually, or changed every now and then. So there are really some complications that may happen to the patient. Okay, so depending on the hospital policy, there are hospitals that strictly ask the nurses to change the IV line for after 2 days or after 3 days, okay, of the IV therapy. And then we have also fluid overload. If too much fluid is given too quickly, you can experience headache, high blood pressure, and trouble breathing. That's why you have to check the doctor's order on how many rate of the IV fluid should be given at specific time. So another is hematoma. This occurs when blood leaks from the blood vessels into the nearby tissues. It looks like a bad bruise that usually goes in very few weeks, especially if you hit the vein and then afterwards it became bulged. Another infection, if the area is not clean or when the needle was inserted, if it's not clean, then infection may occur. Your healthcare provider can usually treat infection with antibiotics. Another, we have also your infiltration. If the needle moves or get dislodged, the fluid can enter the tissues. Instead of into the IV or intravenous, they will now go to your tissues. May cause edema. Okay, and then we have also phlebitis, which occurs when the vein becomes swollen because of the IV. It is one of the more common complications, but is usually treatable by removing the IV, applying warm compress, and elevating the arm. Okay, so again, we have here your types of your IV. You have your isotonic, hypotonic, and hypertonic. So from the word isotonic, the word tonic, it's about the tonicity of the fluid. When we talk about tonicity, it's the number of solutes in a solution. Okay. So solutes such as electrolytes in a solution. So you have to what do we call this? There are IV fluids that would really place a label na how many electrolytes, percentage of electrolytes that is placed in that IV in a solution. So usually isotonic, from the word iso, it's equal. It is a type of IV fluid that has an equal equilibrium or equal electrolytes and solutes and solutions or solvent from our body. Okay? The hypotonics are from the word hypo, meaning low. So it has low solutes and more solvent or fluid. While your hypertonic, it has more solutes than the solvent or solution. So again, we have here different types of your IV fluids. We have your dextrose 5% in water. We have your 0.9 chloride or normal saline solution. We have lactated Ringer. We have your 0.45% of sodium chloride. We have also your dextrose 5% in 1/2 normal saline solution. We have your dextrose 5% in 1/2 normal saline solution. We have your we have also your dextrose 5% in normal saline, and then dextrose 10% in water. So we have here a table that shows what are the uses of the certain IV fluids and what are the special considerations that you need to take into. Okay. So these are the images or some images of the IV fluids that we use in the hospitals. Again, it depends on the manufacturer, so the images can vary. Okay, now let's talk about computations. So we have different formulas that we need to use in order to identify any possible. So example, we have here how many hours to run do we need to compute to finish a 1 liter, 5 ml or 500 ml of IV fluid. So we have the standard, we have two types of IV set that we use for our different patient. We have the pedia, or for the pediatrics or for children, okay, infants. And then we have also the adult set or the macro set. So we have here micro set and macro set. The difference between the two is the needle, okay, and the drip chamber. Mostly in the macro set, it has no needle, okay. So the drop is more the ml of one drop is different from a microset, because in microset the drip chamber of the IV tubing has a needle on it. So for macroset, we use the volume of solution, and then we have the drop factor, 15 drops per ml. And then example, we have the drop rate of 1 drop per minute, and then you have to times it to multiply it to 60 minutes per hour. For microset, we use the drop rate of 60 drops per ml. So this is constant actually. We use, again, for adult, it can be 15 drops per ml. There are books that may give you 10. Okay, it's actually depending on the hospital. It can be also depending on the hospital policy. There are drop rate that are used in certain hospital. They use 30 drops, because in adult we can use the 15 or 30, 15 to 30 drops per ml macroset, and then for microset 60 drops per minute, so per ml, sorry. So example, calculate the hours to run in administering the 5LR 1 liter 30 drops per minute. So example, again, the volume of solution, you have to times it to 15 drops per ml. Why? Because the macro set, the set to be used is macro. So that's why you need to use the drop factor or drip factor, 15 drops per ml. So again, we have here the 1000 times 15 drops per ml times the 30 drops per minute, because this is the prescribed rate of the IV infusion, and then times 60 minutes per hour. So 15,000 divided by 1/8 is equals to 8 hours. So meaning the what D5LR 1 liter should be run within 8 hours of 8 hours, within 8 hours. Okay, so another example, we have the 0.9 NaCl or sodium chloride, 1 liter at 40 drops per minute. So again, macro set. So we have 15,000 divided by 2,400, meaning 6 hours. Okay, so I have different example. You can check on this PPT or my presentation what are the different examples. Okay, and then for the drop rate computation, how will we identify the drop rate? So earlier the hours to run, here the drop rate. How can we identify the drop rate? So for macro set, you have to use the volume times the 15, and then you have to instead here, if you can remember, in the hours to run, the one that is placed here, this one is the drop rate. So here we will now put here the hours to run. So yeah, okay, so again, use 15 for the macro and then 60 for micro. So example, calculate the drops per minute or drop rate to run in administering D5LR for 8 hours. So example, you have volume 1000 ml times drop factor of 15 drops per ml. So we have here 8 hours times 60 minutes per hour. So we have here 15,000 divided by 480. So we have 30 drops per minute. So another we have for microset for pedia. We have here volume of 500 ml for 12 hours. So 500 ml times 60 drops per minute, 60 drops per ml. Okay, so 12 hours times 60 minutes per hour. So we have 30,000 divided by 720. So we have here your 40 drops per minute. So another here example, we have D5 water IV at 125 ml, 125 per ml. 125 ml per hour. So the infusion set is calibrated for a drop factor of 10 drops per ml. So calculate the IV flow in per minute. So we have here conversion factor. So 1 hour is equals to 60 per minute. So we have again 150 ml. So 125 ml per hour. So we have 125 ml per divided by 60 minutes times the 10 drop per ml or drop factor. So 125 divided by so you have to divide it. Okay, so 125 divided by 60 minutes times 10 drops. So we have to we have the answer to 20.8, and you can adjust it by so make it 21 drops per minute. So another, let's discuss IV cannula. So IV cannula is a technique that is used to utilize in order to place a cannula into a vein in order to provide some form of venous access. This sort of access, IV cannula insertion. Okay, IV cannula insertion is a technique that is used to utilize in order to place a cannula into the vein in order to provide some form of venous access. This sort of access will allow medical professionals to get a blood sample as well as infusing fluids to the patient to avoid dehydration, and at the same time providing vital nutrients, medications, chemotherapy, and other transfusion. So the importance of selecting the right gauge. The reason it's important to use the right gauge is because some nursing procedures can only be done with a particular sized needle. For example, if you have a patient who needs to have his or her blood drawn, you'll want to go with a gauge that is large enough to do it. Otherwise, you may end in having otherwise you may end up having to restick them with properly sized gauge. This can cause the patient frustration and pain. So you have to check for that. And then therefore, whenever you start an IV on the patient, you want to ask yourself what type of procedure your patient will be having while in your care. So example, the patient will have to undergo surgery. So you have to insert a IV cannula that has large gauge because the patient who will undergo surgery may need blood transfusion. And in doing so, when giving a blood transfusion, you have to use a larger hole of the needle. Okay, so always follow the protocol set forth by your employer or board of nursing when selecting gauge size. So the importance of selecting the right gauge. So we have here different gauge and then the reason. So 16 gauge is usually or mostly used in ICU and surgery areas. This large size enables many different procedures to be performed, such as blood administration, rapid fluid administration, and so forth. For 18 gauge, this allows you to do most of the tasks that the 16 gauge can, but at large and more painful to the patient. Some of the common uses include administering blood, pushing fluids rapidly, and you can use it for CT, PE protocols, or other testing that requires larger IV sizes. For 20 gauge, you may be able to push blood through this size if you can't use an 18 gauge, but always check your employer's protocol. This size is better for patient with smaller veins. The 22, this small size is good for when patient won't need IV for too long and aren't critically ill. You usually can't administer blood due to its small size. However, some hospital protocols allow 22 gauge usage if necessary. And then for 24, this is usually used for pediatrics and usually only used for as a last resort as an IV in the adult population, especially if the patient is elderly or senior citizen. So we can use that one because typically the veins of seniors or elderlies is prone to collapsing. So we usually use smaller needles. So again, we have here the gauge size. As you can see, we have 14, 16, the 18, 20, the 22, the 24, and 26. So we have here the external diameter, the length of the needle, and the water flow rate. So as you can see, for orange, 14 and 16, usually it is more on rapid infusions, okay, such as trauma, rapid blood transfusion, surgery. So we have also the green one, 18. Okay, this three actually, the orange, the gray, and the green, the 14, 16, and 18, usually used for rapid infusion or blood transfusion or anything that the patient must be given urgently. Okay, for pink one, this is the most used infusion IV set, okay, or IV cannula. So the same with your blue ones, okay. And then we have also the yellow. And then we have the purple for pediatrics because the purple ones is for, it has 26 or 28 gauge. Okay. So, as you can see. Okay. So, these are the different types of IV gauge. Again, when giving IV fluid to your patient, it's very important that you have to reinstitute what is ordered by the physicians. Okay, so I think that would be all for this first part of my discussion for basic nursing procedures. The next part of the video will be focused on nurses, notes, and documentation. So thank you for watching this video. Assalamualaikum warahmatullahi ta'ala wabarakatuh.